Okay, so totally great. And I am going to just maybe kick off the discussion part of this by raising some of the policy and ethics questions that have come up around HPV preventive vaccine, and apply a little bit of the thinking from the first part. So people often talk about should vaccines or any other public health program or interventions be mandatory or voluntary? And as a broad brush distinction, that's okay. We can actually split hairs and categories a lot more than that. I have put 3 categories on here, which I think are relevant to the kind of public health programs that people have been talking about for HPV vaccine. So the first is called mandatory, which actually people, again, who like to be analytically perfect, might call conditionally mandatory, which is the way most of our vaccine policy is, which says something like, if you want to go to school, public school, most other private schools, if you want to go to a lot of day camps, then you need to get the vaccine. It's not actually, if you don't vaccinate your little kids or your teenagers, you get put in jail for not vaccinating them, but you can't participate in most things that most people, in a lot of things that most people want to participate in. So even though we say childhood vaccines are mandatory, they are what I would call conditionally mandatory. It's fine to use the label mandatory. I do it myself, but I want to emphasize that it's another way that these exceptions are built into our policy, and maybe for some people in the name of ethics. So one option for HPV would be mandatory, to pass something that is similar to the way we have policies for a lot of our other vaccines, and say, for example, in order to enter middle school, there are now some other vaccines like this, your kids have to get HPV. Another is routine. And what that means is that it's not mandatory, but every time your kid goes for the checkup when your kid is 11, the pediatrician says, okay, here's the panel that we give at age 11. In the same way that when your kid was 1, they said, here's what we give at 1, they would now say, here's what we give at 11. Which is different from permissible, where they might say, hey, there's this vaccine that's out there. Let me talk to you about it, pros and cons, and you can go home as a family and talk about whether you want it and come back if you decide you want it. Both of the last 2, strictly speaking, are voluntary, but as you can imagine, the uptake from routine is much, much higher than the uptake from the sort of what I'll call permissible. Now, we will get into why the CDC would move from saying that something is acceptable or permissible to doing what, for example, it just did a couple months ago with HPV vaccine for boys, which is to kick it up to the routine category, right? When the CDC thinks that we are now at a point in public health and in data for the intervention that all of the scales are tipping much more to the benefits than to the concerns. This is when public health and the CDC as our federal public health agency say, time to make it routine. But there are these questions with every new intervention, and certainly with HPV, and there are states that have been debating mandatory as well. There's another question, should you have the same policy for girls as for boys, and why? And we can get into that more in the Q&A. I just have a couple slides on what ethically can justify a mandatory program. Because again, in public health, we decide that certain things absolutely should be mandatory, and childhood vaccines I think are one of the paradigmatic example. I love Connie's history slide, and that's an example of, in a lot of ways, at least in this country, something being mandatory and part of what you get from that. So part of what justifies something being mandatory, thinking back to that framework I had outlined, is how big a problem is it? Is it a problem? Is it a big problem? And when we say how big a problem is it, we usually mean the magnitude and the severity. Is it affecting a lot of people? And when this thing that we're preventing affects them, can it be bad? Do the less burdensome alternatives work? And for that, we might say, well, instead of mandatory, if it were just routine, or instead of routine, if it were just permissible, would we get as much coverage? If it turns out we would, then you don't really have to make it mandatory. I mean, truly, there's no reason to make something mandatory if everybody's going to do it anyway. If people aren't going to all do it anyway, that's when these questions emerge. If people are not all going to do an uptake of this without it being mandatory, who are the people who end up getting it, and who are the people who don't? And is there anything systematic about the people who end up getting a vaccine and people who don't? I would love for maybe Connie to say something about, of those 25% of people who ended up following through with all of their course of HPV vaccine versus the 75 who didn't. Were they different from each other? I mean, certainly some national data I've seen says that people of color and people of lower SES are more likely to be the ones who aren't following up. And that has really important implications when we start to debate these policy things. It's not just that some people choose to, some people don't, but if systematically it is poorer people and people of color who are either not starting to get HPV vaccine, or are even before that not getting their pap smears, it raises a whole different kind of question about whether we should change the way we recommend or make mandatory any kind of vaccine. And then how burdensome is it to be mandatory? So why would there be arguments for mandatory? Well, HPV, the vaccine works, right? That data step, it's there, at least for 5 years, and at least if you can believe the kinds of immune markers that are used. It seems safe, not very burdensome. There's 18,000 HPV-related cancers in women per year, 7,000 HPV-related cancers in men per year. This is just in the United States, obviously extraordinarily larger globally. And it's really hard to reach adolescents. So if you look at the likelihood of anybody coming in for their yearly pediatric exam, it just starts to dwindle by the time kids enter middle school. And then there is this idea that I was just talking about promoting justice. And it ensures that all girls and now boys are protected if it's mandatory, whereas systematically it turns out that they're protected in ways that we may find where the differences may be troubling to us as a society if we don't. Why against mandatory? Okay, civil liberties. There are people who don't like mandatory anything. There are people who will vaccinate their own children and don't want laws about it. And it's a rational position, right? We have a presidential candidate who is espousing that position. It's a libertarian view at its extreme. But in public health, again, with my condom example is an illustration. There will always be things where some people say, look, that's ridiculous, don't make it mandatory. And to what length can public health go for something that has data behind it, that will protect the public's health? And is this an example where we're going to vote yes or we're going to vote no? There has been with HPV in particular, because HPV is transmitted sexually, an enormous amount of dialogue about whether we're sending a message to our kids that we're now giving them at the age of 11, our little girls and boys, a green light to go be sexually active. Okay, I hope not, but there is a legitimate question that we have to follow up with empirical data collection about whether the kids who get an HPV vaccine are in any way more likely to initiate sexual activity earlier than the people who don't. Again, there have been studies that seem to suggest so far the answer is no, but given how much that's part of the debate, it's absolutely something we have to get data around. Is there any other kind of public health backlash from perhaps these kids feeling protected? So maybe a message has gotten through that it's a vaccine somehow related to sex. Okay, that's really bad health education. But to the extent to which that message has gotten through, does that mean they're less likely to use condoms? That all of a sudden we've got less cervical cancer, but we've got more teen pregnancies? All this stuff is the kind of thing that people use as arguments about mandatory. They're really important questions. Of course they're important. And, being trained the way I do, I say, right, we got to collect data on that. Of course, there are a lot of things where if they were true, it would make you consider a policy differently. So you got to find out, are they true or not? in the end, not that fruitful to keep saying, but if that happened, it would be really bad. Well, if that happened, it would be really good. Fine, let's see what happens and actually collect the data. Some people say that it's overreaching to require it for all. Just vaccinate those who are at greatest risk. Maybe just vaccinate all those girls we're figuring out are never getting the pap smears. Well, first of all, we are learning that HPV is protecting against much more than cervical cancer. And secondly, we have learned, and this is why some vaccines are now given in a very different way, that I put up Hep B as an example. In certain ways, you really just want to start hepatitis B vaccine before people become sexually active. But because it is so hard to reach middle school kids, babies are now vaccinated with Hep B. It's not because people think they're at risk when they're 1 and 2 years old. It's because it's a time you can catch them. And that becomes, again, relevant. Safety concerns, is it too early to make something mandatory? I will say that I certainly know people who are very big proponents of HPV vaccine, who are themselves saying, I think it looks great, but of course we're going to know a lot more in 10 years, and is that when we should make it mandatory rather than now? Backlash at industry tactics, I only have that up there because, as some people know, when the vaccine was first approved for girls, there were some big policy pushes in a couple states in particular for there to be bills passed that made it mandatory within those states. And it turns out, it was later revealed in a way that probably was really counterproductive for public health, that those policy pushes were funded significantly by an offshoot group funded by the manufacturers of the vaccine. And it made people very suspicious, understandably, about, oh, do you really care about these girls, or do you just want to make a profit? And that whole conflict of interest question soured people a lot to some of the debates about mandatory. It's also expensive. The price has come down since it was first approved, but it's expensive, and people get into these trade-offs. Public health is underfunded. Again, I don't need to tell this crowd. And so is that the best way to spend money, is something that some people say when they wonder about this. I think that this may be, that's my last slide. Just a couple other questions to throw out about HPV vaccine in addition to the mandatory versus routine or permissible policy options. And that's what type of messaging. So let's say, you're in charge of developing the HPV vaccine materials for all the pediatricians to hand out in their offices, or for the public health department to distribute. What do you want to say? And do you want to say, we have a new cancer vaccine, boys and girls need to get it? That's one option. Do you also want to say, or do you instead want to say, we have a vaccine that you have to get before you start sexual activity? So there are ways in which both of these are true, and the messaging comes across really differently. And I think it's a really important question to both think through what's most effective, and also, this is something that I actually love to think about, when we do health education messages, how much detail do we have to provide ethically? I certainly will put out there that my view is that a broad public health message can be very different than the individual counseling we give to people. I think it really is fine that there's a billboard that says smoking kills, even though, of course, when you start counseling someone one-on-one, you say, right, not every single smoker dies, and it's not like you light up one cigarette and you drop dead. And so the way that we do broad messaging must be honest, but it can be quite different than how we do individual counseling. But it becomes really relevant when we're developing messages for something like HPV. And then, should parental consent be required? The age group we are targeting is adolescents. And this does sort of have to do with sex. And maybe the kid hasn't been coming in for the annual exams, but is coming in for birth control. And that's a moment to catch these kids and do HPV. And for most things, we require parental consent. We do have ways in which we allow certain things with adolescents to not require parental consent if they are acting like an adult, like things like birth control. But where does this fit in? So I'm going to stop, and I think we have almost 35 minutes for questions, and I guess we're going to field some, and Molly is going to field some from the email. I want to put out there, I had told Molly that I'm personally darting out at 1:20 because I have to go to New York, but I think Connie's here till 1:30. So thank you.